Missing even one essential mineral can subtly destroy your health if you have diabetes. Furthermore, more than 70% of diabetics already have deficiencies. These supplements aren't in style. Your body requires these vital nutrients on a daily basis to preserve nerves, heal wounds, control blood sugar, and even avoid kidney failure. Surprisingly, most diabetics are unaware of them until problems arise. Your body might be yelling for these minerals if your feet burn at night, your energy levels plummet, or your blood sugar levels suddenly rise. Are you prepared to learn what's lacking from your routine and how to make it better? Let's examine the 3 most important minerals that people with diabetes should consume. Glycinate of magnesium is the first. Magnesium glycinate. Your blood sugar regulation may be subtly ruined by just one mineral. Moreover, the majority of diabetics are unaware of it. This magnesium isn't your average one. Your body absorbs this type the finest. Additionally, your cells cease to respond to insulin when it is absent. The damage starts to spread subtly as the sugar continues to rise. Here's why that's important. According to studies, up to 48% of diabetics are unaware that they have a magnesium deficit. This hidden deficiency is not limited to cramps and exhaustion. It subtly exacerbates insulin resistance, weakens your heart, destroys nerves, and invites an uncontrollable storm of diabetic consequences. Magnesium glycinate, the most efficient form, is a highly absorbable and gut-friendly form that combines elemental magnesium with the relaxing amino acid glycine. Unlike other forms, which frequently irritate your digestive system, magnesium glycinate may be taken directly into your cells. This is the reason magnesium glycinate is so effective for diabetics. It has a direct effect on how your cells react to the hormone insulin, which controls blood sugar. Your cells' insulin receptors malfunction if you don't get enough magnesium, which is like attempting to open a door with the incorrect key. According to clinical studies, taking magnesium glycinate supplements can increase insulin sensitivity by as much as 25%, 31% less insulin resistance, and reduce HbA1c by around 8%. This translates to improved blood sugar regulation, fewer drug changes, and less organ damage over time. More than 300 enzymatic processes are powered by magnesium. However, 3 can save the lives of diabetics: vascular stability, nerve protection, and glucose breakdown. Your blood sugar becomes unstable, and your fasting glucose begins to rise when your magnesium levels fall. Nerve endings, particularly in the legs and feet, start to misfire, and post-meal spikes become more acute. Restoring magnesium levels in diabetics frequently results in smoother blood sugar readings, less leg cramps, and a reduction in nerve pain, particularly the scorching or stinging pains in the feet that can be excruciating at night. Let's discuss numbers. According to studies, magnesium glycinate can lower fasting blood sugar levels by 10% to 15%, even among those who are currently taking medicine. Additionally, it can lower diastolic blood pressure by 3 to 4 mmHg and systolic blood pressure by 5 to 7 mmHg, enough to reduce your chance of having a heart attack or stroke. This is because magnesium lowers inflammation, relaxes the smooth muscles inside blood vessels, and helps avoid artery calcification, which is frequent in people with diabetes for a long time. In terms of your nerves, it's also revolutionary. Magnesium glycinate promotes the brain's natural calming neurotransmitter, GABA, and relaxes hyperactive nerve signals and sleep. For diabetics who suffer from peripheral neuropathy, restless legs syndrome, anxiety, or even insomnia, this makes it particularly beneficial, all typical in people with type 2 diabetes. Indeed, a 2023 study found that diabetics using magnesium glycinate for just 8 weeks experienced a 40% decrease in neuropathic pain. Now, Why do so many diabetics first have low magnesium levels? Elevated blood sugar has a diuretic effect. Magnesium is the first nutrient to leave the body through the urine. Furthermore, magnesium absorption is decreased by drugs such as metformin, diuretics, and even PPIs, which are acid reducers. This implies that your levels can still be too low even if you eat a healthy diet. Often, the first indications are subtle: constipation, anxiousness, eye spasms, muscle twitching, or exhaustion. Behind the scenes, however, your blood vessels are constricting, your nerves are deteriorating, and your cells are having trouble using insulin as it should. Is it possible to obtain magnesium solely from diet? Indeed, but only to a certain extent. One of the best sources is pumpkin seeds, which provide 262 milligrams per 100 EG, or over 65% of your daily requirement. Avocados supply 29 milligrams, black beans 70 milligrams, spinach 157 milligrams, and almonds 270 milligrams. Here's the catch, though. The majority of elderly people don't consume enough of these foods on a regular basis, and the absorption of some drugs decreases with age. For this reason, taking magnesium glycinate supplements becomes not only beneficial, but also essential. Broccoli is one of the most dependable natural sources of chromium, with 22 micrograms per cup, ranking among the top 5 foods that are high in this mineral. 8 micrograms of grape juice per cup naturally sweetens and supports blood sugar levels. Each slice of whole wheat bread contains 10 micrograms. Lean beef gives about 2 micrograms per serving, whereas green beans supply 2.2 micrograms per cup. Even though they may not seem like magnesium glycinate is mild, non-laxative, and safe, even for people with IBS or sensitive digestive systems, in contrast to magnesium oxide or citrate, which frequently result in diarrhea. For seniors who suffer from anxiety or insomnia, it also has the relaxing benefits of glycine, which can enhance sleep quality and lessen blood sugar spikes brought on by stress. Magnesium glycinate, pure encapsulations, and Doctor's Best are among the highly recommended products, each providing doses that are therapeutically efficacious. Depending on age and gender, most persons should consume between 310 and 420 milligrams of magnesium per day. It is generally best for diabetics to go for the higher end, perhaps 350 to 400 milligrams daily, divided into 2 doses with meals to optimize absorption. Always read the label. Instead of listing elemental magnesium, many supplements list the total weight of the tablets. Therefore, 120 milligrams of usable magnesium may be included in a 500 milligrams capsule. However, what about adverse effects? Although magnesium glycinate is well tolerated, excessive use can still have negative effects: low blood pressure in sensitive people, cramping in the abdomen, loose stools, or nausea. Additionally, since too much magnesium can accumulate and harm the heart, special care must be used if kidney function is compromised. Before using supplements, seniors with chronic kidney disease should always consult their physician. Magnesium may also interact with blood pressure drugs, muscle relaxants, and antibiotics. Therefore, it makes sense to space out doses by a few hours. Its profound advantages for the kidneys should not be overlooked. Magnesium glycinate may promote glomerular filtration, lessen oxidative stress in kidney tissues, and minimize albuminuria, a 10 to 20% loss of protein in urine, in early-stage diabetic neuropathy. In poorly managed diabetes, it can even lessen the harmful effects of excessive calcium accumulation in the renal arteries, which silently speeds up kidney failure. How soon will you notice a difference, then? Within 2 to 4 weeks, many patients report increased energy, less cramps, and better blood sugar levels. The benefits of nerve pain, blood pressure, and HbA1c begin to show over the course of 8 to 12 weeks, although consistency is essential. This is not a temporary solution. It takes time for your cells to mend tissues, reestablish enzyme pathways, and regain equilibrium. Second, picolinate of chromium. One of the minerals that subtly maintains the body's blood sugar equilibrium is chromium picolinate. Millions of diabetics, however, are unaware that they lack it. The worst part is that you don't notice it right away. Despite the fact that it doesn't hurt, it is slowly impairing your body's capacity to use insulin. Even if your pancreas is making insulin, your cells won't react if you don't have enough chromium. Insulin resistance is the fundamental cause of type 2 diabetes. Additionally, it causes silent blood vessel damage, elevated HbA1c, persistently elevated blood sugar, and ultimately painful, permanent effects. This resistance can be overcome with the aid of chromium picolinate, the most bioavailable and active form of the metal. It restores your cell's capacity to respond to insulin, improving insulin sensitivity by up to 23%. Glucose is drawn from your blood into your tissues when your cells are responsive again, reducing fasting blood glucose levels, as well as those harmful post-meal sugar spikes that harm organs. According to clinical studies, chromium picolinate can lower HbA1c by 0.6% to 1.1%, which is a significant enough change to lower the risk of dialysis, blindness, and nerve damage in those with long-term diabetes. Poor diets are not the only cause of chromium insufficiency. Additionally, it rises with age, stress, sugar consumption, and even intense physical activity. When this occurs, the warning signs may appear to be normal symptoms of diabetes: sugar cravings, tingling in the feet, hazy eyesight, energy slumps after meals, and infrequent urine. However, there is a more serious issue developing beneath these symptoms. In an attempt to produce more insulin, your pancreas begins to overwork. More fat is stored by your liver. Toxic glucose levels are filtered by your kidneys, raising the risk of protein leakage, nephropathy, and ultimately renal failure. Chromium has several protective functions in the heart. It lowers LDL cholesterol, improves vascular flexibility by 15 to 20%, and lessens oxidative stress on arteries. It lowers the chance of atherosclerosis brought on by silent sugar. This lowers the risk of high blood pressure, stroke, and unexpected heart attacks. Low chromium increases the risk of cardiovascular disease, which is already doubled for diabetics. Supplementing with chromium has been demonstrated to increase blood flow, decrease inflammatory indicators, and lessen arterial stiffness, particularly in people over 50. When it comes to sugar damage, your nerves are among the body's most delicate tissues. Elevated blood sugar gradually erodes the myelin sheath around nerves, resulting in numbness, burning, tingling, and ultimately nerve death. Chromium helps nerve cells retain their appropriate energy and function by improving their glucose metabolism. It has been demonstrated in tests to enhance nerve conduction velocity in long-term diabetics, regulate mood swings, and lessen peripheral neuropathy symptoms. Chromium is essential for lowering the burden of sugar filtration in the kidneys. Better insulin function lowers the amount of sugar in the blood, which lessens the kidney's need to remove it. This lessens the risk of renal inflammation, albumin leakage, and glomerular damage. This causes diabetics to develop chronic kidney disease. By encouraging increased glutathione activity and enhancing mitochondrial function, it also lessens oxidative stress in renal tissue. It even protects against diabetic retinopathy by lowering retinal inflammation and avoiding microvascular rupture behind the eye. By enhancing glucose transport across the blood-brain barrier, chromium also promotes improved brain health and may lower the risk of memory loss impaired focus, and neurodegeneration that are frequently observed in poorly managed diabetes. By stabilizing the intestinal cell's energy environment, it also promotes gut health. Slow digestion or gastroparesis are common intestinal problems among diabetics. Additionally, chromium has a minor but significant impact on enhancing nutrient absorption and lowering the glycemic impact of food. These meals, when consumed frequently, help maintain baseline chromium levels throughout the day. To reach therapeutic levels, the majority of diabetics still require supplements. Depending on age, weight, and the degree of insulin resistance, the recommended daily dose of chromium picolinate is typically 200 to 600 micrograms. These days, Food's chromium picolinate 200 micrograms, Nature's Bounty chromium picolinate 1000 micrograms, and Solgar chromium picolinate 100 micrograms are among the top 3 reliable supplement choices. When taken with food, these are often used and thought to be safe for diabetics. But chromium is not to be underestimated. Taking more over 1,000 micrograms daily can have detrimental effects. It can accumulate in the kidneys and liver, causing toxicity, stress on the organs, and in rare instances, damage to sensitive tissues' DNA. When using large amounts over an extended period of time, some people may get headaches, nausea, or dizziness. Consult a healthcare professional first if you have thyroid problems, liver or kidney disease, or are on steroids, depression, or anxiety drugs. Protecting the endothelium, the inner lining of blood arteries, is one of chromium's most underappreciated functions. Constant sugar spikes in diabetes cause damage to this layer, which eventually results in clotting, leaky arteries, and organ damage. By strengthening and preserving capillaries, chromium helps your eyes, skin, nerves, and brain receive oxygen and nutrients more effectively. Additionally, it lowers C-reactive protein by 12 to 20%. This directly correlates with the risk of heart disease and inflammation. Additionally, this mineral affects muscular function, preventing the muscle atrophy associated with poorly managed diabetes. Chromium increases strength, energy generation, and glucose uptake in muscle tissue. It may also aid in weight loss by regulating blood sugar levels and lowering cravings for sugar. Even after eating, people with chromium deficiencies frequently experience fatigue, hunger, and mood swings. Taking this mineral as a supplement can significantly lessen these symptoms and improve metabolic rhythm. Third, pollinate with zinc. Most diabetics never consider the mineral zinc picolinate, yet its deficiency subtly impairs the body's capacity to fight, heal, and operate. Your insulin starts to malfunction, your pancreas becomes irritated, your nerves malfunction, and your blood sugar starts to fluctuate uncontrollably the minute your zinc levels dip, even a little, which is riskier. Even though you can't feel it, it is happening. And your body is in more serious distress than you think by the time you notice it. Zinc picolinate is the most bioavailable, the most absorbable, and the most important form for diabetics. This is due to the fact that more than 65% of diabetics are unaware that they are zinc deficient. You may appear to be in good health, but on the inside, your wounds are healing more slowly. Your immune system is deteriorating, and your risk of problems is increasing every minute. Zinc is not only beneficial, but also necessary. It directly affects the production, storage, and utilization of insulin by your body. Insulin becomes unstable without it. Insulin resistance silently increases as its power declines. Zinc supplementation can increase insulin sensitivity in individuals with type 2 diabetes by up to 26%, according to clinical studies. There's more. It has been demonstrated that zinc lowers HbA1c levels by 0.5% to 1.2%. 2%, contingent on dosage and duration of use. On paper, that type of decline doesn't appear good. It prevents your heart, kidneys, and nerves from gradually failing. Zinc pollinate increases insulin sensitivity in your cells, which facilitates the smooth passage of glucose from your bloodstream into your muscles. Because of this, zinc users have an 18% decrease in fasting blood sugar. Additionally, there is a 25% decrease in post-meal surges. Those are not negligible figures. That is the distinction between silent organ damage and well-managed diabetes. The fact that zinc insufficiency first manifests as mild symptoms further heightens the fear. Your appetite changes, your wounds cease to heal, or your skin becomes parched. But the true harm begins deep within. The same cells that make insulin, your pancreatic beta cells, start to malfunction. You develop complete insulin dependence after they are gone. Additionally, zinc regulates the hunger hormones ghrelin and leptin. In the absence of it, your body begins to accumulate body fat, increase your desire for sugar, and worsen insulin resistance. Additionally, zinc picolinate protects your heart. It decreases cholesterol, reduces inflammation, and fortifies the vascular endothelium, the delicate artery lining that sugar frequently erodes. According to studies, vascular flexibility increases by 12 to 15% when zinc levels are high. This translates into improved blood flow, a lower chance of heart attacks, and defense against silent strokes. Additionally, it reduces C-reactive protein, a risk indicator for inflammation, by as much as 30%. A big advantage for diabetics who are battling to keep their hearts safe. Let's discuss the nerves that diabetics struggle with on a daily basis. Zinc reduces oxidative stress in peripheral nerves, enhances nerve conduction, and shields the myelin sheath. This is essential for reducing or perhaps curing diabetic neuropathy, which causes discomfort, numbness, and burning in the hands and feet. Zinc improves nerve health scores by more than 20%, giving those who suffer in silence genuine hope. Low zinc also silently harms the kidneys. Zinc picolinate aids by lowering systemic inflammation within your kidneys, enhancing renal filtration, and decreasing protein leakage. Antioxidant enzymes that protect against sugar damage, such as glutathione peroxidase and superoxide dismutase, are powered by zinc. Zinc helps the kidneys retain their structural integrity, filter more effectively, and lose less protein. Early zinc restoration may actually help postpone dialysis for years. Additionally, most diabetics are unaware that their immune systems are constantly being attacked. Zinc sharpens white blood cells, increases T-cell activity, and fortifies your body's defenses against infections such as UTIs, foot ulcers, and skin sores. Additionally, it is essential for wound healing, cell division, and DNA repair. If your zinc levels are low, even a minor scratch could become hazardous. However, taking zinc can increase recovery by 30 to 40%. You can save a limb with that type of speed. Where can I find zinc? The richest source is oysters. You get 74 milligrams, or more than 600% of your daily requirements, in just 3 ounces. However, how many of us eat oysters every day? Let's face it. 7 milligrams comes from beef chuck roast. Thighs of chicken provide 2.7 milligrams. Each ounce of pumpkin seeds contains 2.2 milligrams. Additionally, a half cup of cooked lentils provides roughly 1.3 milligrams. The catch? Plant-based zinc is not as well advertised. Therefore, food alone is frequently insufficient, particularly for diabetics who have low intestinal absorption. Supplements are important because of this. These days, foods containing 50 milligrams of zinc picolinate, 15 ml of thorn zinc picolinate, and 20 ml of Solgar zinc picolinate are among the greatest options for diabetics. Men and women need between 11 and 8 milligrams per day, respectively. However, diabetics frequently require 15 to 30 milligrams per day to achieve noticeable effects. Because zinc can cause nausea when taken on an empty stomach, it is best to take it with at meals, preferably in the evening. Don't go overboard, though. Consuming more over 40 milligrams per day can damage your kidneys or liver, impair your immune system, and result in copper deficiency. Overdose symptoms include nausea, vomiting, metallic taste, and worse, low white blood cell counts that increase the risk of infection. Diabetics must avoid long-term overdose since it can upset the equilibrium of their cholesterol by pushing HDL down and LDL up. Hormones are an additional factor. Men's testosterone levels are raised by zinc, which benefits mood, energy, and muscle. It increases thyroid hormone conversion in women, which is important when diabetes and hypothyroidism coexist. Zinc fortifies the intestinal lining in the gut, avoiding leaky gut, which is a covert cause of insulin resistance, autoimmune flare-ups, and chronic inflammation. Additionally, it aids in the production of digestive enzymes in the stomach, which diabetics frequently lack and which can result in fatigue, bloating, and nutritional loss. These three minerals might be the solution your body has been waiting for when it makes silent requests for assistance. Pay attention to the signs: slow healing, tingling feet, and inexplicable exhaustion. They're more than merely jing. They are cautions. So act right away. Provide the nourishment your body needs to combat diabetes, safeguard your nerves, and maintain stable blood sugar levels. Please hit like, subscribe to Health Angel Solutions, and share with a loved one if this opens your eyes. Because nobody should have to endure suffering simply because they didn't.